Hi guys, welcome back to our course, Introduction of the Chinese Herbal Medicine via the Western Herbs. Today the topic for the introduction in the Western herb is very special. We call it the palmetto. I think you don't know that one because it's not common for everyone. It's only for male. The palmetto extract is extract of the fruit of the sereno, the repens. It is rich in fatty acid and phytosteroids. It has been used in traditional, eclectic, and also the alternative medicine to treat the various of conditions. And now the most people know is using for the benign prostatic hyperplasia. We call it BPH. So palmetto is used in several forms of traditional herbal medicine. American Indians use the fruit for food and to treat various of the urinary and reproductive problems. The Mayas drank it as a tonic, and the Seminoles used the berries as a patent and antiseptic. The palmetto is a fan palm that grows a tree or shrub that can reach height to 10 feet in a warm climate. In the United States, it's grown in the warm climate of the southeast coast, from South Carolina to the shore of Florida. And they have the white flowers, which produce the yellow berries. The berries turn to brownish black when they ripen and are dried for medicinal use. And berries that will stop food, and also for the medicine for the Native American people of the southeastern United States. In the early 19th century, men used the berries to treat urinary tract problem and even to increase the sperm production and boost the libido. Today, the primary of use of palmetto is to treat benign prostatic hyperplasia. We call it BPH, a non-carcinogenous enlargement of the prostate gland. Researchers think the palmetto may affect the level of the testosterone in the body and perhaps reduce the amount of the enzyme that promotes the growth of the prostate cells. So palmetto is often combined with natto extract to treat BPH. What is BPH? It's a common urological conditions caused by the non-cancerous enlargement of the prostate gland in the man when men get older. As the prostate enlarges, it can squeeze down on the urethra. The symptoms consistent with BPH are known as lower urinary tract symptom. This causes men to have the trouble urinating and leading to symptoms of BPH. Okay, this is picture we show is normal prostate. In another picture, they will show is enlarged prostate, BPH. So you can see on the blood, the urine on the blood, they could not, get the urination smoothly because the prostate is become bigger and to narrow down the tract of the urination. And the men with the BPH may take a palmetto in a effort to reduce their symptoms, and several studies suggest that the herb is effective for treating symptoms, including the too frequent urination, or have trouble starting or maintaining the urination, and needing to urinate during the night. The urethra, the tube of the empties urine from the body, runs through the prostate gland in men. When the prostate gland is enlarged, men have the trouble for the urination. However, A 2006 study find that supplemental was just effective at reducing symptoms of the BPH as a placebo. So that different kind of clinical study have a different kind of opinion, but people still believe the supplemental still have an effect for the BPH. The supplemental has some, anecdotal success in treating the BPH. In some men take it in effort to stop the growth of the cancer cell in the prostate. Because supplemental also can affect the man testosterone level. According to the ACS, chemicals in supplemental berries prevent the body natural response to the testosterone. This kind of interference reduces the prostate cell growth. So the man with BPH may experience the few symptoms as a result. Yeah. Okay. So even the researchers do not understand how the supplemental chemical actually turn a man's testosterone level, but at least they find it is work for some patient with BPH. Okay. And for the detailed mechanism for the supplemental for the BPH, some people also thought is inhibition of the both forms of 5-alpha reductase with no reductions in cellular capacity to secrete the prostate-specific antigen is indicated. Another proposals for this kind of mechanism, including the interfering with the dihydrotestosterone binding to the androgen receptor, relax the smooth muscle tissue similar to the alpha antagonist drug, and act as the phytoestrogen. The side effect, actually, few side effects can logical reactions are found in the supplemental extract. The most common of the GI problem, some of which may be reduced by the taking extract with the food. So using may increase the risk of the bleeding or affect sex hormone. So the concurrent use of another drug or similar action should be avoided. The beta-acetylsterol, a chemical present in supplemental extract, is chemically similar to the cholesterol. The high level of the acetylsteroid, the concentration in blood, have the correlated with increased severity of the heart disease in men who previously suffered heart attack. What is made of? Remember, it's not from the leaves. Okay? Yeah, that's from the fruit. So supplemental active ingredients including fatty acid, plant steroid, and also flavonoids. The berries also contain a high molecular weight polysaccharides, such as sugar. Okay? So it may reduce inflammation or strengthen the immune system. The available form in the market, you can find liquid dried berries only, and also can find some powder, the capsule or tablet, and also some people use the liquid tinctures or the liposteroic extract. The product label should indicate that contents are sterilized and contain 85 to 95% fatty acid and steroids. How to take it? Liposteroic extract in the capsule. One study, the dosage for the early stage of BPH is 160 milligrams twice a day. The supplement should be a fat-soluble supplemental extract that contains 85 to 95% fatty acid and steroids. And liquid extract, the preparation is not being tested in any study. Yeah, so it's, this kind of effectiveness is not known. Okay, the tea, supplemental can be taken as a tea, but its active ingredient, we know is fatty acid, could not soluble in the water. So the tea may not be effective. Yeah, so you should know maybe the better to take the dry berries with a meal, much better than the effect. The possible interactions, pro-sucker, because the supplemental may work similar to the final site, should not use the herbs in combination with the final steroid or another medication used to treat the BPH unless directed to by the physician. And also have another interactions with the antiplatelet or anticoagulate drug. We call it the blood thinners, because the supplemental may affect the blood ability to clot and co-interfere with the blood thinning drug. And when you have the oral contraceptive and also hormone replacement therapy, the supplemental may reduce the number of the estrogen or androgen receptor. This does have the hormone-like effect. Yeah, it may be take oral contraceptive that less effect. Yeah, and also have a problem with raising the risk of unplanned pregnancy. And the supplemental and the libido, because the supplemental interfere with the testosterone's effect in the body, and the low hormone level means reduce the prostate symptom. Some men take it for this purpose, but another take a supplemental in hopes that it will increase the testosterone's effect on their bodies. So according to the ACAs, men sometimes take the supplemental in order to increase their sex drive, improve libido, and also have function to increase their fertility. And in United Kingdom, they also have another product. Because we know it's good for men, not good for women. But they also apply supplemental to use for the for the healthy growth. So they can you can use for the optimal the health growth, not only for men, also good for ladies. So the products you use for the supplemental is berries, and you can use it for infusion or tinctures, or using it with another herb to make a remedy. But don't forget, because the constitute for the supplemental is most of the fatty acid. So if you just make a tea, it's not effect. So this is the introduction about supplemental in this chapter. Thank you.